Hello everyone, thank you for joining. Welcome to another of the Nature, Towns and Cities webinar series. This one is focused on improving health through urban green and blue spaces. I'm Matilda, I'm a project manager for the Nature, Towns and Cities programme, and I'm going to speak for the first few minutes to outline what you can expect from this session and share a little bit more information about the programme. Next slide please. So this session is focused on health and wellbeing in urban green environments, and the session will mostly focus on several great examples of working on this agenda. We'll have two fantastic case studies from South Tees and the NHS Greater Manchester's work on green social prescribing, who will be presenting with one of their delivery partners, Northern Roots. Each case study will share their learnings and experience, and particularly what the benefits of their approach might be, followed by a panel Q&A. We'll be using an interactive whiteboard through the session, which we'll use to help inform our later panel discussion. Next slide, please. We'll be introducing our speakers throughout, but to give you an idea of who you'll hear from, and if you need it to refer back to, this slide shows the range of partners and colleagues who'll be speaking today, all ably chaired by Dave Bell from Natural England. Next slide, please. So before we dive in, firstly, there's a few helpful bullet points on the screen about how the session will work. So if you have a question for our speakers or to submit to the panel about health and wellbeing within an urban green context, please use the Zoom Q&A feature throughout the presentations, which you can find at the bottom of your screen now. We have enabled automatic captioning for the day, so if you want to turn these on and off, you can do so in the settings along the bottom of your screen as well. And just so you know, the session is being recorded and will be emailed to you directly and available via our website in the coming days. Next slide, please. So we will be using an online interactive whiteboard throughout this webinar and some of our future webinars. It includes helpful links to the things discussed today and some more helpful information about the programme. To access the Miro board, please use the link in the chat. You can also put a message in the chat if you need any help setting up the tech. So we'd really love you to add to the board throughout, specifically today answering those two questions on the screen now, which are about embedding health within planning and policy work. There'll also be a 5-minute pause between the sessions where you can have a break and also work on the whiteboard directly. We'll be pulling out some of those answers from the board to start our panel discussion later on. Next slide, please. So that's everything from me on housekeeping. Before we dive into the topic, I also wanted to say a little bit more about Nature, Towns and Cities and how it all fits together. In October, we also hosted a sort of longer introductory webinar on the programme, which you can watch now via our website if you'd like any more information after this. So Nature, Towns and Cities is a wider programme which aims to work with at least 100 towns and cities across the UK to transform access to green space. The programme has people at the heart of it, and the overall goal is about millions more people enjoying time outdoors in their local urban place. It includes a grant scheme, an accreditation process, and an inclusive network. The grant will support many towns and cities with much needed capacity to do this work. The accreditation process will provide the assurance and confidence places are on the journey to achieving their goals in this area. And the network will provide the inspiration, support, and connection for people to take action everywhere. The programme was founded by National Lottery Heritage Fund, Natural England, and the National Trust. And we're working closely with Nature Scot, Natural Resources Wales, and the Northern Ireland Environment Agency. And we hope lots more partners. Next slide, please. So this webinar is a part of the taster sort of series, which will give a flavour of what's to come from the network component of Nature, Towns and Cities specifically. The network is designed to build confidence, capability and connection, and ultimately to support those working on access to green space. It's open to everyone and it's free to be involved. Through the network, you'll gain access to knowledge and successful solutions about what's working when it comes to green spaces. It'll be a place to connect with other people who are leading for change from a range of fields relevant to towns and cities, including working with communities, green infrastructure and green finance. There'll be opportunities to collaborate and build new partnerships. It's a space to tap into the collective wisdom of peers and experts from the sector and beyond. You'll be able to take part in and lead events, join cohort learning activities and access resources. The network will be shaped by all of us, and in collaboration with you, it will grow, iterate and evolve to best serve those working on urban green places. It's an opportunity to be part of something bigger, and ultimately we hope the network will help the programme create a movement for change. So please do sign up to our mailing list via the website now, so you can keep up to date with the programme and read a little bit more about how you can be involved. So what's left is for me to hand to our chair for today, Dave Bell, who is a Principal Officer for Health and the Environment at Natural England. Thank you.
Thank you, Matilda. Hello, everybody. Yes, my name is Dave Bell. It's great to see over 100 people on the call today. I think that proves what an important piece of the jigsaw this is in our work to align health and nature recovery, particularly in our towns and cities. Yeah, it's great that we're able to support this work through the Nature Towns and Cities programme and to be part of that. For some of you, this might be the start of a conversation. For others, this might be part of the conversation you've been having for a long time. Until my sound quality's a little dodgy.
Yeah, good. Okay, perfect. Right. Thank you, everybody. Yeah, so as I said, hopefully this will be the start of a conversation for some people on the call. For others, you might already be partway through aligning nature recovery and health priorities. What I would say is, the Nature Towns and Cities programme is a great way to engage in this opportunity, in this agenda. My role as chair today will be to try to bring out some of the examples and some of the questions that you have of the speakers. If you go to the next slide, please. At very high level, wanted to flag, some of the underpinning research around why access to nature is critical for our health and well-being. This is a report that we published in Natural England earlier this year. There's no great sort of shocks here. Green spaces are good for us. Engaging with nature is good for children, etc. But what this does is it starts to provide more detail about the specific health conditions and health outcomes and how that can support, how access to nature can support those specific health outcomes. So I think it's trying to get us into a much more aligned position with the health sector, in terms of what the health sector is looking for and how we can align our plans to improve access to nature with the things that the health sector are really interested in. The next slide, please, is just a reminder maybe for some, this report from Public Health England in 2020, which really has some strong findings here about there's compelling evidence that we need to join up access to green space in our health systems. They should be considered critical for maintaining and supporting health and well-being. And I think this is particularly important to think about in light of the consultation that's going on the future of the NHS. So just a reminder for anybody on the call, that closes on the 2nd of December. But what these two reports, pieces of evidence show is the evidence linking nature and health. Where the challenge has been how we actually join that up at a strategic level and a practical level across the country. And I'm really pleased today that we've got colleagues from South Tees and from Greater Manchester who'll be able to talk a little bit about their work that's actually putting this into action. So I hope the sound has settled down for everybody. Apologies for the issues at the start, but I'm going to hand over now to Mark, who will come in and talk about some of his work in South Tees.
Thanks, Dave. So I'm Mark Fishpool. I'm Programme Director for You've Got This, and I'm presenting today with my colleague David McAleavey on some of the work we've been doing at a strategic level in South Tees, which is the boroughs of Middlesbrough and Redcar and Cleveland within the Tees Valley, and some of the work we're doing particularly around green space and particularly about integrating nature and some of our health priorities into that work. Next slide, please. So first of all, a little bit about the programme. So where You've Got This, we're one of 12 systems change initiatives funded by Sport England. They're exploring new ways of shifting the dial on physical inactivity. And within our area, we have the vision of active lives as a way of life, recognising that if we want to encourage people to be more active, that may include formal sport, it might include traditional exercise and such activities, but equally it's about how do we enable people to build physical activity into their daily lives. And we're part of Public Health South Tees, so the public health service that covers both boroughs, and all the work that we do is delivered not by our very small core team, but almost entirely by a collaborative partnership of organisations. And underlying all the work that we're doing is building a sense of common or shared purpose around physical activity, promoting collaboration over competition, building leadership for physical activity right through our system locally, and grounding everything that we do on insight and learning. Within all of that, the physical environment we see in our place is a key driver in increasing physical activity. And through our existing relationship with the Tees Valley Nature Partnership, which covers a slightly bigger geography than ours, but very much within the urban area of the Tees Valley, is recognising the role of nature in creating spaces that bring the health benefits that Dave has talked about already, but particularly for us through our work with Sport England as an opportunity to create better quality spaces that encourage people to be more physically active. And in doing so, we're using that opportunity to bring together social capital and natural capital in our place. Next slide, please. The area that I've been particularly involved with, and particularly relevant for our involvement with public health, is through what we call the Joint Strategic Needs Assessment. Now, Joint Strategic Needs Assessments are a tool which are vested generally in public health, although they are not public health specific. They are designed to engage partners across a place. And they're really about identifying some of the key health needs in a locality and coming up with a plan, a collaborative plan with shared common purpose across a number of organisations as to how we start to address them. And traditionally, the way that that will be done will be through having a specific group of people that's targeted in a JSNA, or a particular condition or issue such as fuel poverty or obesity. In South Tees, our Director of Public Health, working with us, wanted to do things differently, and he came up with what we would call a mission and goals approach, which is a bit more asset-based. So it's about identifying an overall mission of a direction of travel we want to take, and then some of the goals that we will achieve in getting there. And we led on this one, which is we will create places and systems that promote well-being. And you can see one of the 4 goals in there is about how we create places with high quality green spaces that reflect community needs, provide space for nature, and are well connected. So very much linking in with the Lawton principle. And the way in which we've gone around doing the JSNA has been collaborative. So working with a whole range of partners in place to come up with the key issues and the key recommendations, and going beyond the traditional use of intelligence and data, which is often where public health is embedded, into using qualitative insights, interviews and workshops to underpin the development. Next slide, please. And through that process, this is what we discovered. First of all, the people who were involved in the development of the JSNA, who were people, mainly practitioners from work around green spaces, are passionate about what they do and they really value the spaces around them. But often those efforts are not well coordinated. And we actually know very little in our place about how people are using green and blue spaces and the barriers to their use. And that's a specific area then to work on. And one of the key factors that came out is differences in the value that is placed on green spaces by decision makers. Some value them a lot, some not so much. So moving forward, and this is my last bit before I pass on to David, it's very much about how do we build a value in our place of green spaces as part of improving both physical and mental well-being, promoting better coordination of those spaces in South Tees and the management of those spaces, building our social capital around using them, and also how do we use the planning system for future developments to increase the amount and diversity of green space available. David.
Thank you, Mark. So my name's David McAleavey. I'm the Creating Active and Healthy Places lead at Public Health South Tees. My role is funded through You've Got This, which Mark's just told us about. And what I'll introduce you to first is just the basics, the key aspects of my post, which is neighbourhood design, healthy homes, healthier food and food environment, transport, including active travel, infrastructure and transport, and then something that permeates all the way through all of those others, not least through the green infrastructure, highways and street-based greening schemes, and just greening in the public realm more broadly, that generally weaves our communities together, nature and sustainable environment. The contact and exposure to the natural environment has implications for improved health and well-being. Now, some of you might have recognized those 5 themes. Next slide, please. So this is the umbrella review that was commissioned by Public Health England, which identified the existing review level evidence of the association between the built and natural environment and health outcomes. So some of the work that Dave introduced us to earlier, this is building on it specifically in the for planning and transport planning context. The review centred on 5 aspects of the built environment, which make up those 5 aspects of my job. So neighbourhood design, housing, healthier food, transport, natural and sustainable environment. Next slide, please. These 5 aspects of the built environment and the natural environment were identified as the main characteristics that can be influenced by planning policy. These aspects of the lived environment can be designed and shaped by planners in order to promote certain health outcomes. In Middlesbrough, we're currently working with colleagues across planning and transport planning to ensure a thorough understanding of this evidence base and to build consensus around how best to plan for health in light of it. Next slide, please. So Mark has already introduced us to South Tees JSNA and this particular chapter's mission and our goal, and what we discovered and what we plan to take forward. Next slide, please. So what I'm going to do in the short time that I have to contribute is basically go through how we're going to address or how we're going to move forward on deliver this JSNA agenda. Next slide, please. So now Mark's already mentioned the Tees Valley Nature Partnership, and Esther from Natural England, who's on our panel today, is also working with this group and colleagues across Teesside University and partners across the whole of the Tees Valley. And one aspect of that is working as the Nature, Health and Wellbeing group. And our work aims to connect nature, the environment and health strategies, organisations and projects to maximise the benefits for people, nature and the planet. Our mission is to work collaboratively as a group representing diverse health, nature and environmental interests by identifying opportunities and pooling resources. Our objective is to integrate health and nature into strategies, policies, programmes, projects and processes at local, regional and national levels. One strand of this project is working with urban environments, where our objective is to enhance urban resilience to health challenges by incorporating a full spectrum of nature's direct and indirect health benefits into urban design. Our approach is to collaborate with planners, policymakers, and community stakeholders to integrate nature-based design principles into urban environments, optimizing sites to meet health needs. Now, what I'd like to do is illustrate a few of these strategic coordination efforts on our part. So next slide, please. So whilst it didn't come out of the JSNA process, one piece of work that was already in place that we are looking to build on is the green infrastructure strategy that was produced to give Middlesbrough Council a better understanding of the green and blue elements of Middlesbrough and assist in the development of its local plan. There are 6 key themes. Next slide, please. Regeneration, heritage and a sense of place, biodiversity, geodiversity, reconnecting communities with nature, a resilient landscape, a blue network and waterfronts, walking and cycling. So whilst I would argue that all 6 of these themes can be understood as promoting the health and well-being of the residents of Middlesbrough, we'll focus just for a moment on themes 3 and 6. So you can see that theme 3 is to help to narrow the gap between the health and well-being of Middlesbrough residents and the rest of the UK through the provision of maintenance of strong, connected and truly accessible green and open space network. And in theme 6 is to support the borough's modal shift ambitions towards active travel by creating attractive walking and cycling routes and better connecting to the town's network of greenways. Next slide, please. So here's a map of the key green and blue assets in Middlesbrough. And as you can see, a linear park suggests itself running diagonally through the heart of the town. Next slide, please. So this is building along and beyond that potential linear park, and this project is the Tees to Topping project being led by the National Trust and is anchored around their Ormsby Hall site. It's being promoted as a green corridor for people, planet and nature in South Tees. And working with colleagues across planning, transport planning, open space management and sustainability in Middlesbrough and Redcar and Cleveland, as well as the Tees Valley Combined Authority, we're looking to promote a greater level of strategic coordination through projects like this. So for instance, a recent development, which is being led by Middlesbrough's DM lead, is a project to integrate this network with a development site comprising thousands of new homes and one of the largest employers in the Tees Valley, the James Cook University Hospital, into an integrated active travel green corridor. Next slide, please. Now, whilst at a very early stage, this is Eston Recreation Ground, which is an area in Redcar and Cleveland, which is a significantly underused urban open space. So YGT, organisation for which that Mark is the director, saw it as an opportunity to secure additional funding as well as revenue funding from YGT. And at the first stage of the process, there was an extensive community consultation, which included on-site sessions, meeting residents and the community venues, building on insight collected through sentiment analysis and storytelling. So whilst at a very early stage, and social capital remains an element that is an aspiration of this project, we're very much hopeful that this will be part of our JSNA delivery. Next slide, please. So here's an example. Well, this is just the designer's impression of what the site will look like or might look like once we've had the investment. So when it's completed, we hope that the Eston Recreation Ground will become an asset for maintaining and supporting health and well-being for its communities. Next slide, please. So an integral part of health and well-being policy that we're writing for Middlesbrough's emerging local plan is that all new residential and commercial developments that meet certain criteria will be required to complete a HIA. And this is our draft toolkit. So a HIA, for those of you who aren't familiar with the term, is a health impact assessment, and it's a process that identifies the health and well-being impacts, benefits and harms of any plan or development project. A properly conducted HIA recommends measures to maximise impacts, positive impacts, and minimise the negative impacts, and reduce health inequalities. According to Trude's research, that is the tackling root causes upstream of unhealthy urban development, 38% of local authorities include requirements for HIAs in their local plans. Now, environment is one of the 11 themes in our toolkit. Next slide, please. And to illustrate how the JSNA is being integrated into our new planning policies, we can take this example of the deficiency of access to public open space. So with the acknowledgement that this is a draft, so what we've used is the Green Infrastructure Toolkit from Natural England to inform the way that we are setting certain expectations on developers for addressing issues in deficiency in public open space in wards where there's an issue of access to green and public open spaces. Next slide, please. So we've used, as I just mentioned, the Green Infrastructure Toolkit from Natural England as the way of setting our benchmarks and our baselines for this particular aspect of the HIA going forward. Next slide, please. So I just thought I'd finish up on the final slide, my final slide this afternoon, which is the fourth section of our environment theme. Just to emphasize the point I made at the beginning of my contribution today regarding the extent to which the natural environment, through the lens of health and well-being and the kind of net gain image, will hopefully be woven throughout all of the future development in our neck of the woods. So thank you for listening. I'll pass back to Dave, I think.
Hi everyone, and thanks very much. I'm John Myint, I'm a Programme Manager at NHS Greater Manchester. We've got Anna De Silva as well from Northern Roots, who's going to take us through some of their work that they're delivering through their natural health service. Anna, are you okay to come on there?
Yeah, I think so. Thanks, John. Can we go to the next slide? So I thought I'd give an overview of Northern Roots first, and then John and I will pass back and forwards between us in true partnership style. So Northern Roots is a partnership developed initially with Oldham Council, and the land that we're working with is mostly owned by Oldham Council, and it's quite a unique and very ambitious project. So we have 160 acres, which starts right in Oldham Town Centre and runs all the way out, as you can see in that picture, to the Peak District and down to Tameside, which is the neighbouring borough. And it was all industrial land. So we used to have 2 large cotton mills, 2 coal mines, a railway line, and just at the bottom of the site, a steel works. And the communities around the site essentially came into existence to work in that industry. The industry all disappeared with the end of the Industrial Revolution. And then a big chunk of the middle of the site was actually the council tip for 50 years. And we also have a large combined sewage outlet tank on the site as well. So it's a really great example of all the evil by man has done to land over about the last century. And because of that, it's kind of been abandoned. And I think there are spaces like this all around our post-industrial towns and cities, which are often adjacent to the most deprived communities. And so this project was really about identifying the value in green space, just as Mark and David had been saying in the previous presentation, and saying, is there a way that we could bring this bit of space back into use to improve it for nature, but also critically to harness it for economic, skills, education, employment opportunities for local communities, and altogether to improve health and well-being. So it's a great big project that encompasses a lot more than just our natural health service, but delivering health and well-being outcomes is an absolutely key thread that runs through the whole project. Next slide, please. So I won't dwell on this, Dave already mentioned it, but there are hundreds and hundreds of peer-reviewed papers which for years have been evidencing why this is important and why it should be more mainstreamed in our health and social care and actually education sectors. And the real challenge, I've been involved in this space prior to this job, also with the Royal Horticultural Society. The real challenge seems to have been getting the kind of health and care system on board, and particularly commissioners and people who hold budgets. So I'm very excited. It's really interesting that we've now got on this presentation, you know, I'm here with someone from the NHS, and Mark was here with someone from public health. That feels like a real step change. And it just does feel like this is the moment for this to become much more mainstreamed because of the importance of the whole prevention agenda. We've also looked at the JSNA for Oldham, and I think it's very striking that the areas in which green social prescribing, access to green space, that mediated supported access, can make the biggest difference are to a lot of the conditions which are most pressing and also most preventable in Oldham's JSNA. So that's also why we're really building in this area. Next slide, please. I think this is where I pass over to John.
Yeah. Thanks, Anna. And Anna mentioned the Industrial Revolution kind of ending on the site that they use, and obviously quite a lot across the rest of Greater Manchester and the UK. But I think on Anna's site in particular, and what they're doing in Oldham is a great example of a new revolution in health and well-being, and using the natural environment to achieve those things. So you may be aware that Greater Manchester have previously been one of 7 regional delivery partners working with NHS England, DEFRA, Natural England, and other national bodies to scale up the delivery, test and learn how to scale up the delivery of green social prescribing. So that work finished a couple of years ago. The initial program, at least, finished a couple of years ago, but a few weeks ago now, the evaluation results from that initial pilot program were published, and there's some summary findings on this slide. So through using the natural environment for health and well-being, we were able to demonstrate that with an average cost of £507 per person, green social prescribing was a very cost-effective method of dealing with society's mental well-being issues and problems. And that's when compared to typical mental health interventions like CBT and early intervention for psychosis. We reached a broader range of people than a lot of those services typically are able to access and provide support to. So a lot of young people aged under 18, ethnic minority populations covered about 21% of the programme, and individuals from socio-economically deprived areas as well. So a lot of that was by design and intention in the way the programmes were delivered across all of the regional areas, and just a testament to the good work that our local community-based organisations who deliver these services are able to provide, and the offer that they have within those local communities to be able to give people the chance to access their programmes. So the programme showed that from a return on investment perspective, for every £1 invested in the national programme, £2.42 were kind of came out of that as a return on investment. And I believe the life satisfaction score was the primary driver for determining what that figure was, as you can see on the ONS scores in that chart to the right. But there was a separate research evaluation report that was produced by Lancashire Wildlife Trust, or the Wildlife Trust nationally, who Lancashire Wildlife Trust, being one of our local partners, were part of the programme. In their own local evaluation and research, they also found that for every £1 invested, £2.16 was returned as a cost saved for treating mental ill health through their programmes. So lots of really good data to back up the kind of, I think, what we all know and understand, that accessing nature-based interventions in the natural environment for mental ill health has huge benefits for individuals and can really benefit the health system through freeing up capacity and bringing a return on investment for money spent on it, which is hugely beneficial. As I said, there's the ONS scores for the national programme. There were a variety of different outcome measures that were used. I believe ONS 4 was the primary one, but you can see a positive change in all of the areas that we'd want to see. So an increase in happiness, life satisfaction, feeling worthwhile, and then a reduction in anxiety, which is obviously what we want to see. So really great data to kind of back up what we're speaking about here. Next slide, please. So this is just a bit of a timeline in terms of what's been happening across Greater Manchester as a citywide region. I mentioned the 2-year NHS England and DEFRA programme that started in April 2021. It was a 2-year funded programme. By the end of that, we had reached over 1,300 participants on our programmes in Greater Manchester. Over £750,000 of funding had gone into community-based organisations, and over £300,000 of that was match funding from across the community and voluntary sector. So just an indication of the appetite and the kind of demand for it within the voluntary and community sector as well as across the health system. And we had over 70 organisations involved in the delivery of our programmes across Greater Manchester. So just a small slither really of the total number of organisations and community focused groups who can offer these sorts of programmes, but a huge number nonetheless for those organisations being involved in our programme. The national programme formally came to an end in March 23. But in Greater Manchester, as well as I understand all of the other regions that were involved in the national programme, work continued across our health system to further embed green social prescribing as a method of addressing health and wellbeing across our society. So we were able to continue to pay and fund those programmes that were involved in that initial pilot to continue. We had green social prescribing written into our population health strategy as an approach for dealing with mental and physical wellbeing. We had it written into our NHS Greater Manchester Green Plan, and whilst those things may seem trivial, it's very difficult within a system to get certain approaches written into policy. So those two things give us a couple of policy levers to get in front of commissioners and funders and embed these sorts of approaches further within the health system. We've also been working with our colleagues at Greater Manchester Combined Authority to embed nature-based health approaches and access to nature more generally into the 5-year environment plan, as well as adopting access to nature and promoting the health benefits of access to nature through the local nature recovery strategy as well. And that will help drive policy and planning at a local authority level to use nature as a means to better our mental and physical health. Then at the start of this year, 2024, NHS England and DEFRA was successful at coming forward with additional funding to essentially continue and extend that initial 2 years worth of funding for that programme. And now we're using that funding to test within Greater Manchester to test the impact of green social prescribing, specifically with ethnic minority communities who we know face the biggest health inequalities, as well as serious mental health with one of our mental health trusts, Pennine Care, and their early intervention teams across 3 localities. And so that's kind of on the delivery side, but we're also funding a learning network in Greater Manchester, which we've put in place to continue to build the network that has grown over the last few years through all of this work to support individuals and organisations to scale up their skills and capacity with resources and training to be able to hopefully have them be able to offer more programs like this within their local areas. By the time this round of funding will finish in March next year, we will have a local evaluation report also commissioned within Greater Manchester, which we're hoping to use to target at commissioners and funders within the health system, as well as other policymakers and planners from across the different sectors, local government and our combined authority, to again just try to really extend the reach of these sorts of programs within policy and planning at a local level. Next slide, please. And this is just an overview in terms of this extension funding now from what we've been doing over the last 6 months till the end of March next year. The green delivery partners start in Salford, Manchester Myint in Manchester, and Northern Routes. They are our delivery partners addressing health inequalities and targeting individuals from ethnic minority communities to take part in their programmes. And then the organisations in the Blue Squares, Lancashire Wildlife Trust, Petrus and Groundwork, they're focusing on the serious mental illness with canine care and their early intervention teams. And then we've got our partner City of Trees, who are leading on our GM-wide learning network to, as I say, scale up skills and capacity across organisations to deliver these sorts of programmes. The next slide, please. Back over to you, Anna.
All right. So I was really struck with what Mark and David were saying about that amazing joined up focus in the Northeast about creating quality green spaces accessible to everybody. But and we're doing that at Northern Routes, and I think more widely across Oldham. But another critical part where this presentation really comes in, I think, is in then making those quality green spaces accessible to the people who will really benefit from them the most. And that can be physically accessible, but I think often it's far more emotionally accessible, psychologically accessible, sometimes culturally accessible with some of the communities that we have around our site. And that's not as easy as it might seem. It takes quite a lot of detailed understanding of the communities, the barriers, their relationships, and working out how to get through to those folks. So this is at a very sort of high level a taxonomy that we use, which was developed by Care Farming UK and Thrive, which is a big horticultural therapy charity some years ago, but I think it still really works. And so it's looking at how can everything that we do improve that access for our communities to our green space, all the green spaces nearer to their homes. So the outer level are people who need the least help, who can kind of get themselves to those green spaces with the right kind of encouragement, and can access that semi-independently. So in a Northern Routes context, that might just be the folks who come excuse me, and walk their dogs or bring their kids to play. Or it might be, you know, we have a whole arts and culture and heritage strand to what we're doing. And it might be folks that come along and take part in a lovely community heritage event that we hold and that we will commission to really focus them on connecting with the nature that is the venue for that activity. The middle ring, so nature-based health promotion, maybe people who need a bit more support to come and access and engage with the green space, but not the kind of intensive support that our Natural Health Service provides. So, for example, we have a whole education and skills strand to our work, and we have young people coming to us from high school on alternate provision who've generally got undiagnosed neurodiversity or learning disabilities, really struggle in a school environment, but when they're outside in nature, can really benefit and calm down and restore their focus and be able to go back and remain in the mainstream school sector. And then that middle circle, the green care, is really our Natural Health Service, and that's for the people who really need the most support to, you know, physically, psychologically get down to us. And as those arrows indicate, you know, people at different stages in their lives and depending what's going on can graduate in and out of those spaces and need more or less support. Next slide, please. So very quickly, this is the story of the Natural Health Service at Northern Routes, and it's not been going on for that long. So, I mean, I've been on this project for 5 years, but deliberately didn't really try to start this work until last year because it needs to be done well. It can do a lot more harm than good if it's not done well. And I think that is one thing to take away from this presentation. There's a sort of, can be a general acceptance that anybody that's got a green space can do this, but it really needs to be done with some quality. So I wanted to make sure that we had enough conditions to do a good job. Another big challenge with this, which probably most of you on the call will be aware of, is funding. And so hilariously, I actually launched the Natural Health Service at Northern Routes with National Lottery Heritage funding, just like the folks who are funding this call. And really, they shouldn't be the people having to fund this. And hopefully the outcome of Nature Towns and Cities will be that they no longer have to fund it. But we started with a small time-bound pilot with our local GP practice, who we're very fortunate are amazing and really open-minded. Primary care can struggle with this area. And they chose the cohorts they thought would benefit the most, which in the first instance were adults with diabetes and pre-diabetes, and adults with anxiety and depression. In fact, when people come to us, they might have those boxes ticked, but generally with our local communities, very high levels of social isolation, and often lots and lots of other long-term sort of physical comorbidities and just complex lives. And a lot of people just not leaving the house. Off the back of that, we got a commission from Get Oldham Working, which is Oldham's employability service. And again, focusing with people with sort of long-term mental health problems often, or just lack of confidence. Off the back of that, we then got a commission from Oldham Public Health with Turning Point working with Drug and Alcohol Recovery Group. We've also developed a sort of onwards pathways for some of our participants. So we've got a wellbeing volunteer session where people can come off their own bat or graduate into that. Then with a partnership that we have with Salford University and Edge Hill University, we are actually now the urban case study for a 9-country EU Horizon project looking at how to mainstream access to green space for mental health in adults across Europe. I'll put a link to that in the chat because that's really useful. And then finally, we've got the contract with John and his colleagues on the Health Inequalities Project, which is predominantly focused, or we're focusing it on South Asian ladies who live near to our site. So I think a learning from this is, this can work for all sorts of different cohorts, and we very carefully version our offer, our timing, the kinds of activities to these different groups, but it's really widely applicable. And I think something for public health, public sector colleagues on the call to think about: who are your local partners, your local green spaces that you could make this accessible through. Next slide, please. So briefly, what are we doing? I think, there are a few key elements to how we do what we do and why I think it is so effective. So critically, it's very, very person-centered and flexible. A lot of the people that are being referred to as are the most vulnerable people and the people who are furthest from being able to access services. And as soon as you say you have to be at this place at this time for this many weeks with this endpoint, that's too big a barrier in itself. They can't deal with that. So we have to have the resource to be flexible enough to enable them to in their own time come to us, and often getting them physically to us for the first time is the biggest barrier, and we have to put a lot of energy into that. Once they're out to us, there's a lot of getting to know them, their individual goals, their challenges, their objectives, and we have the luxury on our site, because it's so big and we've got so many different activity strands, to really offer a wide variety of different activities, groups, what have you, to folks, so that it's as relevant and accessible to them as possible. So we have all sorts of different sessions, different activities, but critically, it's all about giving people quality, really mindful access to nature, but also to a community, and connecting people within that community, and looking at how they can take those elements, the nature and the community, back with them when they're not on our site, and continue to feel those benefits in their everyday lives. Next slide, please. We are trying to forensically document the kind of impact of this, because we need to make this case to practitioners, to policymakers, to funders. So we use the 5 ways to wellbeing, which we've added 3 more to, so it's our 8 ways to wellbeing, and the Warwick and Edinburgh mental wellbeing scale. And I need to stop. But I mean, I suppose the headline is, it really works. And we also get data from our referring partners, which show that they're seeing a real change. Next slide, please. I think this is our final one. So just to say, yeah, we see at Northern Roots itself, huge opportunity to expand this. The biggest barrier is money. There's enormous demand. We also very much see ourselves as a hub with the potential to support spokes and shoots across the whole of Oldham, in other green spaces, in our school communities, in potentially the NHS estate. And again, I think that's something you could see nationwide. And over to John to finish.
Yes, just very quickly from me, I think the first thing I'll say is just to be aware and open to the growing body of evidence. I think we're probably preaching to the choir with everyone kind of being here and opting in for attending webinars like this, but there's a huge amount of evidence out there. I don't think we need any more. It's always nice to get more data and evaluation to back this up. but the case is proven. Nature-based interventions can be used for treatment as well as prevention. So depending on your line of work, it's something worth bearing in mind. We can address health inequalities and the environmental crisis together. The two go hand in hand. I don't think we can solve one without the other. So if your work is more on the environmental side, please do bear in mind the access and the health inequalities that can benefit the environmental crisis as well. And just to look out for opportunities to use nature-based interventions and access to green spaces through things like social prescribing in your areas of work. There's, as I said, so much work that backs this up and says it works now. We just need to look for opportunities to embed it further. And then if you are a commissioner or you have money, commission more of this. Organisations like Anna, Northern Roots, a kind of gold standard example of what can be done with our natural environment to better our society's mental and physical well-being. So let's do more of this.
Thank you so much, John and Anna, and to David and Mark. They're both really, really fascinating talks, and the work you're doing is so valuable. So I'm really looking forward to hearing more of your thoughts in our Q&A. But first, we're just going to take a few minutes break, giving everyone a chance to have a tea and open the interactive whiteboard and have a go at the 2 questions that are in there. So we'll come back together at 1:28. And if you need any help accessing the whiteboard or submitting questions for the Q&A, you can drop a message in the chat. Thank you, everyone.
So I'll be hosting the Q&A session. Thank you for all the comments that have gone on the mirror board so far. We will try to come to those towards the end and just see if the panel have any reflections on those. As a reminder, we were looking for examples of where health policies can include access to green space or green space interventions within them, and also where, in terms of vice versa, healthcare policies can embed, green space policies can embed health messaging and health policies within them. So we've got a great panel today. We've got Esther, who is a Senior Officer for Health and Environment in Natural England, in addition to the speakers that we've already had today. So I'll just give Esther a minute to introduce herself to everybody, and then we'll jump into a Q&A.
Thanks, Dave. So I've got the really enviable job of working with people like David and Mark, who just explained some of the work that we're doing in South Tees. But I work more broadly than that. I work also Yorkshire as well as the North East. And it's just such a really rich area to explore how we can do things differently and join up health, recovery and nature planning. So yeah, or nature recovery and health planning even. But yeah, so it's really interesting to see what people are doing. But there's, as we know, there's quite a few kind of challenges as well. So things like funding come to mind, and pathways to care, and making those strategic links in a language that people can understand, so we can see where we can help each other's efforts, and how do we use all of the kind of rich data, both qualitative and quantitative, to understand if we're making a difference. So loads and loads to think about. Fantastic that this programme will be allowing people the headspace to be thinking about those things strategically in a way that will really lead to embedding things in terms of delivery and placemaking.
Thanks, Esther. That's really helpful background. Thank you. So there's a specific question for Anna and John in the chat that I'll just tee John and Anna up for now. But I just want to come to Mark and David first, to see if you could just share a bit some of the barriers that you've had to overcome in the work in South Tees. You're on mute, I think, Mark, still.
Thanks for that, Dave. Right. I think we could probably spend a whole afternoon talking through barriers to some of the work that we're doing. But I think specifically in relation to what we're talking about today, I think I'd focus on some of the ways of working and traditional approaches to work. So, for example, some of our that we spoke about in our presentation about people's views of what an open space is, what purpose it should have, what physical activity is, are all areas that we've had to kind of challenge as part of this process, and beyond that as well. I think this idea of value, and actually, and it was very clear in the presentations today, wasn't it? Especially from John and Anna, about broadening that understanding of what the value of a green space is beyond what we may traditionally think of it as for formal sport or formal recreation. Dave, is there anything you want to add?
I was going to say that I think you managed to break down those barriers before I took the post up. So lots of those barriers to the sorts of work that we're looking to do now, because of the hard work that you had done over the 3 or 4 years before my post was created, meant that, so I'm obviously thinking about a project mark like Andy, who is our DM lead, is very interested in finding ways of using an active travel corridor that's being proposed by National Trust and Natural England working together. He sees it as an opportunity of promoting health and well-being across potentially thousands of new homes across the south and west of the town. And I think, so the barriers that were there that you have addressed through the work that you've done meant that when I started in my role, people were already aligning their respective agendas. So we were able to integrate and be a bit more strategic about how we can take those opportunities and really leverage them for the most benefit for health and well-being.
Yeah, and I think that collaboration element is really important. And we were very fortunate in the Tees Valley that we already had a very well-established nature partnership, which was also founded on very collaborative principles. And so, yeah, another barrier that we had to overcome early on was, and we did that particularly through our programme around how we commission work and using a collaborative commissioning approach, was kind of getting away from traditional competitive ways of working based on very transactional relationships and often quite well, outputs really rather than outcomes, and trying to shift that across into a collaborative way of working where people bring their strengths and we focus much more on the impact of what we're doing rather than just on outputs.
Thanks. It's really interesting. I wondered if John or Anna, if you had any reflections on that, if that's the same as your experience. I'm not sure, John, from the work you've been doing around local nature recovery strategies before your role in the Integrated Care Board, if you've seen that similar sort of approach it's moving from specific individual streams to more of an outcomes approach, if that's been your experience as well.
The background with the LNRS, with the local nature recovery strategy, we've certainly seen good steps forwards in integrating kind of access to health and nature, or access to nature for health within local policy and planning. So I think the LNRS it's a hugely important strategy on of itself, but I think we can really work with it to kind of embed health interventions and access more generally to nature as part of those, the planning and the objectives that go into those strategies. I'm not sure from more of an outcomes perspective in terms of the LNRS, but the work that we're doing across the health system, kind of with more of a person-centered prevention approach, definitely those kind of outcomes and that outcome-focused approach is something that we've seen an increase in interest and adoption of across the health system over the last few years.
Thanks, John. I want to come to Anna next, just on a specific question here in the Q&As around running sessions with vulnerable people and what mix of expertise you've had to find in order to run those sessions.
Yeah, it's a good question. So we started a year ago with one part-time person who comes predominantly from a mental health background, who has then gravitated more towards nature actually as part of her own healing journey, and so has a real mix of the two, but I think comes very much from the kind of health and well-being background and has grown into the green space. She's also very creative and musical, and she brings a lot of that to her work. as we've got more and more commissions, we've had to recruit more people. So we have a second member of staff who has actually been working. Sorry, I'm getting a lot of sound back. Who's been working with very challenged young people in Oldham for about 30 years with children in care or children who have to be removed from violent situations, and again has found her way to nature as part of her own coping and healing strategies. And then alongside that, with a broader programme, we have what we call community champions, who are local people who are very representative of our different local communities, who we've paid to almost act as an interface between us and the communities and inform what we do. And 3 of them through that project have found out about green social prescribing and become very passionate about it. So we actually have 3 of them also on a sort of sessional basis helping to deliver sessions and support the activity. So very much lived experience at the fore.
Thanks, Anna. Apologies, I am on my phone. The audio is for this session. I'm not on hold to BT if they still exist or anything. So funding has been mentioned in the chat. The big elephant in the room is often funding. Where do we get funding from? What's the most effective way of building joint funding pots? I wondered, Esther, if you might kick us off with some reflections from your work around various funding streams, and then insights from the rest of the panel on the funding mechanisms that have worked in your areas.
Yes, so unfortunately, there's no one really obvious source of funding for activities like green social prescribing, and you're probably aware that there's currently a kind of third year of the pilot that's looking at that kind of issue. But I come from a fairly entrepreneurial background in terms of kind of social entrepreneurial approaches to things, and we'd always be looking at a kind of stacked funding model there too. But I'm particularly interested in things like the habitat banking that came from the Plymouth experience, where they were habitat banking for biodiversity net gain. I think from what they were saying, more from a kind of governance point of view, like this is a sensible thing to do. But critically, my understanding is they took up that really kind of community embedded co-creation model, which is, you know, very much what Mark and David's approach is. And it became so much more than a thing around financially looking at your biodiversity net gain duties. So I think it's like looking at those sorts of stacked and multiple funding resources that could include things like commissioning, grants funding, maybe social entrepreneur, enterprises, things like that. And importantly, it's about understanding exactly what works and why, and having that range of evidence, including lived experience, to show what the highest quality provision is. So to make sure we're funding things that have the most impact for nature and people. So no one easy answer, I think, but I think it's about looking at the range, but then also really getting our metrics in place in the broadest sense of the term to show what works and to fund more of that.
Thanks, Anna. I hope the audio is still working okay for everybody. I know we've had a few issues. We'll carry on, and hopefully everyone can hear what we're covering. So yes, I don't know if Anna, you wanted to come in. You mentioned obviously the HLF funding was a key sort of, was the funding pot for the work that you've been doing. I wonder if you have any thoughts on what the funding landscape needs to look like in the future.
There's always the big question. I think it's really encouraging to see the work at a policy level that David and John in particular have referenced, and getting this mainstreamed into policy, because I think that makes it easier for the people who hold the budgets that should be funding this to make those decisions. I would say on the ground, we're still a very long way away from that. So I think it's getting in there at that top level, but for that to filter all the way through different commissioners and practitioners, and for them to feel informed and confident enough to make those investments, we're quite a long way away. I think certainly in Greater Manchester, we have really seen a shift in the last 5 years of much more systematic funding to the link workers, the social prescribing navigators, if you like. So what we call sometimes the travel agents, who are taking people who are prescribed, referred, and referring them on to places like us. That's lovely, but we haven't seen that systematic funding coming to us, the holiday destination, the receiving partner, which is very short-sighted, because we're supposed to just fund ourselves somehow. But also, if you want to be assured of a quality service to give you the confidence to commission consistently, you actually need to fund that service properly. But as John said, that can be a lot cheaper than some of the other more clinical, medicalised interventions that these people might otherwise receive. So I think in our case, I mean, you've seen just from those examples I've given, yeah, we started off with Heritage Lottery funding, out of which we've managed, as Esther said, in a very entrepreneurial way, to leverage about 5 other sorts of funding, which are more from the local authority, public health world. But I'm still stitching together little bits of short-term money, spending a lot of time getting them when I could be spending it actually doing useful things. And at this point in time, we don't have funding beyond spring of next year. So it's very difficult to build a high-quality, professionalised service in that world. I am, right after this call, going to go and write something I've been asked for by the head of the ICB in Oldham to see if they could commission us as a core service from next year. If that happens, I think that would be the holy grail, and it would be quite rare from my experience. I'd love to hear from others on the call if that's happened anywhere else. But that's really a lot of lobbying and petitioning and hard work on our side. If that can happen, that can unlock so much more value for them and all of those referring partners, for us, and critically for people in Oldham and beyond.
And I think a really good question out to the wider audience on this call. Please do pop stuff into the Miro board if you do have examples where you've been working really well with ICBs in terms of commissioning nature-based solutions, etc. That would be really good to have those, and we can use those to help sort of drive more systemic change. So I just want to come to Mark and David. The JSNA outlines how access to green space needs to be part of the response to the health challenges up in Teesside. So I suppose a similar question is, where's the funding going to come from?
Yeah, thanks, Dave. I mean, sort of following on a bit from what Anna was saying as well, I think with this one, we can't get away from the fact that funding is a challenge, and it's particularly a challenge for the VCS. My last role, I was 18 years working for a VCS organisation, and it was the number one issue. It was always finding the resources to do the work. I think one of the things I'm noticing amongst funders now is more of a move towards the kind of collaborative type of working that certainly Sport England have encouraged us to do, that Nature Towns and Cities is very much promoting. So I think from a funding point of view, although it also means extra work, and for small organisations, that's a capacity issue. It's about being in some of those places and being able to build some of those relationships. And as Anna's mentioned, the links that she's now got with the ICB is one that hopefully will then be able to get resourcing for the work that she's doing. I think in our place, at the moment, there's a fair amount of capital money around through things like Levelling Up and Town Deal, but not called that anymore. And it's about how we in the places to actually direct and move some of that funding to the things that are our priorities. Nest and Recreation Ground is a good example of that. The revenue side is, again, how do we start to build those relationships with public sector organisations where they put that value and that trust in the VCS to deliver the quality services that they do. And certainly with our programme, we deliberately went out of the way to create only a very small core team of staff so that the work that we're doing is entirely delivered by VCS partners working collaboratively. And the benefit of that isn't only getting the work done and all of the benefits that come from their trusted position in communities, it's also then the opportunity to work with them to change the way that they think, in our case, about physical activity. So they're moving their position based on the work that they're doing with us, as well, so building their own capacity, as well as being in a better place than public sector organisations often, because of their trusted position in communities to deliver the impacts that we're looking for.
Thanks, Mark. I want to give David or John a chance to come in on that funding piece. Any insights you wanted to share?
Yeah, I think from us in Greater Manchester, it's a similar approach to Esther was saying around a combined and collaborative approach across various sectors and funding streams. I think we've all acknowledged how difficult funding can be from within the NHS and the health system. It is often directed to those frontline services, that clinical care that historically has taken up the majority of the resources. I think that's starting to change slowly within the health system, where there's an acknowledgement that we need to put more resources into prevention in community-based interventions to address these sorts of health issues. But I think that at the same time, there's also a lot of work going on across the environmental sector to improve and create new green spaces. And it just makes so much sense to join up the two to achieve both at the same time. It doesn't always guarantee funding, but I think if you can achieve more than one thing in the work that we're all trying to achieve, it makes that funding more likely to come forward and be more successful. So there's a lot of that work taking place across Greater Manchester Combined Authority at the moment with some of their environmental funding, and a lot of our environmental NGOs across Greater Manchester as well are doing an awful lot of good work across the natural environment for the sake of the natural environment, but embedding it with a person-centred and an accessibility approach as well, which obviously improves the health and well-being of our society. So I think it takes a joined-up approach, and there's no silver bullet and one way that will work best, but I think the more we can collaborate and join up in terms of what we're looking to achieve collectively, then the more successful we're likely to be with funding.
And I would just echo what John's saying, but in the context of planning. So some of you may be familiar with the BNG, the biodiversity net gain legislation, the issues to do with nutrient neutrality, as well as long-standing Section 106 and SIL pots. It's about, for instance, the example I mentioned to do with teas with topping, colleagues are very keen now to try and get the maximum benefit for health and well-being by aligning as best we can strategically our respective ambitions, so that some of that really substantial funding that will come forward with a big development of 500, 1,000 houses can actually be used instead of a series of little silo projects on a site, where can be properly and much more strategically integrated. So that's what I would add on that question. Thanks.
Thank you, David. Yes, there is a tool which has been developed in Natural England called the Environmental Benefits from Nature tool, which people might be interested in, which takes those biodiversity net gain calculations and helps to do some scenario planning that you can use locally. Say, if we did X, these are the types of benefits it might provide to people. I think that's something that'd be really interested on feedback from people and how that might help align these two agendas. We've got a few minutes left, but Esther, I know a lot of your work is about joining up across the sectors. I just wonder if you have any reflections from your work on the things that maybe work, or the approaches that you've taken in order to join up health and environmental planning and delivery.
Yeah, so if I was going to try and pick one thing, because David and Mark have really demonstrated that kind of collaborative approach, I think where there's a lot of opportunities is that nature is an underused asset for people. So we talk about an asset-based approach, an outcomes-based approach. And as part of that, it's about being able to think innovatively about how nature can be, nature and people can support each other. So I know some people get a bit turned off by talking about nature as kind of an asset, but we've been able to, because of the really great collaborative and insightful way people are already working in the T's, we've been able to unlock the way people think about nature through using insights, using a framework to discuss how nature-based solutions in themselves can help enhance people's experience of nature. And that's enabled people to come together in workshops and think differently about some of these spaces that we're talking about, like in Eston. So what that might look like or sound like is that rather than making that equation of, oh, if you've got some green space, you could be used for recreation and that could improve physical health. It's about imagining all of the richness. And I know David and I have had loads of really interesting conversations about the kind of aesthetic benefits of nature and the kind of visual diet, I think is the phrase that you use, David. And actually, once you start talking that way, even people who aren't from like a kind of nature or health background get really enthused. So we've had discussions around how amenity green space like in Eston can be used as a real centre for community kind of creativity, and it could be a social hangout. And talking to landscape designers who've talked in terms of creating prospect and refuge natural spaces where you can actually enjoy the bad weather by enjoying kind of rain from a kind of naturally designed green infrastructure piece. So it's being able to kind of move away from a very simple equation of we need to provide, it's fun of course we need to provide access to nature both nearer to home and further away, but how do we design it, and what needs are we trying to meet, and what difference are we expecting to be seen as a outcome both for the environment and people and nature. And that's where I think there's real opportunities, but it does take a bit of collaboration and learning. And again, this kind of space and time and headspace that this programme would provide, I think could really unlock some great initiatives.
Thanks, Esther. And very quick, I'm going to squeeze a last question in, which I'd like to just bring Anna and John in maybe initially, just very quickly, on how you've been measuring impact of the work, and what are the really any key lessons in terms of the messages or the bits of data that really hit the right mark?
Yeah, from a strategic perspective, for the programme as a whole, we're using the short Warwickshire Edinburgh scale, so the SWEMWebs. That goes against the usual NHS doctrine of using ONS for outcome measures. We've gone with this primarily because I think it's got a better mental health focus, but I think also from feedback from delivery partners, it's easy to implement and resonates more with individuals going through the programme when we're recording these outcome measures pre and post programme. But that doesn't come without its own challenges. We know, given the nature of and background and issues people going through our programs are facing, bombarding them with a whole load of outcome measures and how they're feeling on any given day can sometimes be insensitive and inappropriate. And also we're facing kind of language barriers, cultural challenges as well in terms of the delivery of those and the understanding of those. But it is a measure that gives us a way to see whether there's been an improvement across the program. So that's the way we're primarily using it from a pure data perspective. But what we're also doing is collecting case studies, stories, anecdotes, any way to communicate the impact of these programs at a personal level that resonates with people, to try and show and demonstrate the impact it can have at the personal level. And obviously we've got our evaluation partners on board as well to try and capture all of that information and convey it in the most compelling way. So that's what we're doing at a strategic level. Anna, I don't know if you want to speak more about kind of how that's actually done at a local level and delivery of some of those challenges in mind.
Yeah, so we do try to collect kind of quite a lot of systematic data, although it is quite a burden on staff time, but it's really valuable. So as John said, we use short Warwick and Edinburgh scale and our evolved 5 ways to wellbeing model. All of our participants, so that's kind of quant data if you like, all of our participants also have a reflection journal. So at the end of every session, they'd probably write how they were feeling when they arrived and how they felt when they were left. And it just allows them to really reflect on what works for them, what impact it has on them, and shares that back with us. We share data with our referring partners. So for example, the GP shares with us any kind of reduction or change in numbers of appointments, in medications and key blood markers, whatever might be appropriate. Turning Point share sort of adherence to drug and alcohol recovery programs or whatever might be relevant. And it can be quite laborious and yes, quite a barrier to the kinds of people who need this the most. So we really try to make it actually a meaningful part of their time with us rather than a box ticking exercise. So we've made these, anything we need people to fill in with us, we do it with them. We don't just hand it over to them. We've made it look beautiful and gorgeous and kind of in keeping with the wider experience. And it's really a tool for a conversation, either at the referral, getting to know you, goal setting process, or for the how far have you come, what does the next stage look like process, rather than a we need you to fill in this stuff so we can justify our existence, which is not fun for anybody. And so we do both the kind of quant side, but also storytelling. Storytelling is a really powerful part of everything that we do, and also powerful for reaching out then to other people who might not think this is for somebody like them, but then they see somebody that is like somebody like them, and maybe they lean in as well.
Thank you, Anna. That's great. We've come to the end of our time for Q&A, so I just want to say a massive thank you to all the contributors today. It's been really rich, insightful presentations and discussion. Apologies for my sound issues. Yes, I will try to resolve those for future sessions. One of the quotes I saw on one of the slides, Anna, I think that you shared, was "Thank you for making my life a whole lot better." And I just want to reflect that actually this is the personal impact that this work can have. I wanted to just make sure that we're all recognising that. And I would say a big thank you for all the work that's going on in this space from people who've been on the call, but also elsewhere. We've had around 100 people with us today, and that number is maintained throughout the audio issues. So thank you for everyone that's stayed with us. I'm going to hand over to Matilda very quickly just to wrap up and outline next steps and how you can continue to follow the work of the NHS Towns and Cities programme.
Thank you, Dave, and a particular thank you to you for persevering through those sound issues. And I'll echo your thanks to all the speakers and panelists today. So it would be fantastic to stay in touch with you all. Please do visit our website to sign up to our mailing list, where we'll be hosting lots of our events and lots of our resources. You can also sign up to our newsletter there. So we've come to the end of the webinar, so I'll thank you all for joining one more time, and our panel members and speakers. Hope you have a lovely rest of your day. Thank you.